So, with rare diseases, one thing, and honestly, disease in general, insurance is always a factor.
Hmm.
So, what is it like in navigating the insurance landscape? What challenges do providers usually come up against?
Yeah, it could. Yes, it can definitely be challenging, and I think it's challenging in different stages. So for the diagnostic stage, it can sometimes be a challenge, and um, there will be sometimes pushback depending on the insurance company about doing the broader testing, which is the whole exome or whole genome kinds of testing, as opposed to panels that do a group of genes. And there can be pros and cons of both approaches. But I think that, again, it comes down to the advocacy of the importance of having some of these other tests done in certain situations. It might not always be the appropriate first route, but often it is. So there's some of that advocacy. And then the other piece is I do think there can be cost saving with it, actually. If we're doing it more rapidly and more commonly, it's actually probably less labor intensive then. And you might be able to get buy-in from the company as opposed to running multiple tests here and then another one and then another one. So that's part of it, I would say. And then the treatment side of things, that's a challenge too. And to be honest, I think that's also an ethical issue that we're probably going to come up against. So, in my experience with CLN2 disease and the NCLs, there's the treatment called cerliponase alpha that I think I had mentioned before. And I've been fortunate where my patients haven't had any issues getting access to it. But that I think it is an issue in other places. I've seen some stories even in other countries where it can be an issue getting access to it. Um, and and so in some ways, part of it becomes a conversation about how arguing that it can ultimately save money, honestly, in the end for the companies, right? Because you're trying to keep them out of the hospital as they decline and get sicker, if you can try to keep them stable. But then there are other diseases too, and some of them I'll be talking about in my talk here where there have been newly approved treatments, but they're expensive. So how do you get insurances to buy into that? And I'm not sure. I think that's still an area that's kind of uncharted right now. So for example, one of the things I'll be talking about is going to be a new treatment for metachromatic leukodystrophy, or MLD. And it's the first approved drug specifically for this disease. It was approved a few years ago in the UK and the EU, but it was approved last year by the FDA under the name Lenmildy. And it's, I think, $4.25 million. So it's a hefty price tag, right? So I understand that there would be hesitation to it. So I don't have an answer to it. I don't have a solution, but it's definitely an area that we need to talk about because that's huge.
That's $4.25 million for whom?
Right. Yeah. Does the insurance cover it?
Is that the treatment for a single patient or for a single dosage?
It is a one-time treatment. So yes to both. But that's a lot. Yeah. And it's a rare disease, so it's not like we'd be treating a ton of people, and it has a very narrow indication for who with that disease actually would qualify. But that's an area that I don't know. I don't know how we get past it. I don't know if it comes down to how do you decrease that cost? Is there a way to decrease that cost? Is it coming from the industry, or is it other areas that are challenging because it's a very involved treatment? So that is an area that like I said, I don't have the answer for, but I think we need to talk about it.
As far as trends go, do these diseases typically spread out among men, women, races, ethnicities? Is it clustered anywhere? Has there been any geographic things?
Yeah.
Are there any insights in that regard?
I can speak at least for the NCLs, and they are equal, men and women. We don't see a difference necessarily in terms of prevalence. And probably mostly since they're autosomal recessive and they're not related to the X or Y chromosomes. But as far as where they're located, a lot of them seem to be more prevalent in Northern European countries, I would say. We see a lot more there, although there are certain variants of the different diseases where they have clusters. So there's, some that tend to have more prevalence in Turkey, some in other Mediterranean areas. And they used to get those titles, Turkish variant, Mediterranean kind of variants. And so And so, yes, they do tend to cluster in certain areas of the world, but they also can be seen across races, ethnicities, countries.
Interesting. Wow, this has been a great conversation. Is there anything that we haven't covered?
I don't I don't think so. I think the big take home I would say is, especially for the latter part, is it's a really exciting time in pediatric neurology. It's a really exciting time in rare diseases. And while there are a lot of unanswered questions, I think that it's still like we're moving in the right direction. And I think that's most important.
That's a great note to leave on. Thank you so much for your time for joining us here on MD Newsline.
Thank you.